Hello viewers, today we have with us Dr. Laxman Jessani, who is consultant infectious disease specialist at Apollo Hospitals, Navi, Mumbai. Welcome doctor to our live session. Doctor, today we have questions from the members of Shagun Cooperative Housing Society, Seawoods. Doctor, this topic is related to COVID-19 vaccination for senior citizens. First question is, if someone is suffering from blood pressure, diabetes, or cancer, should they take the vaccination?
Very good afternoon, friends. Today, I think we are discussing a very important topic about COVID vaccination, and I'm ready to answer these questions. So, the first question is very relevant. It's regarding whether the patient can take COVID vaccine if the patient is having cancer or diabetes or blood pressure. Well, the short answer is yes, he can. And the reason why he can take it is because even though the patient is suffering from diabetes or cancer or blood pressure, these are some of the conditions in which the immunity is lowered down. So it's all the more reason you should take the COVID vaccine because it will protect you against this deadly disease of COVID. So anyone suffering from these disease can definitely go ahead and take the COVID vaccine, whether it is Covishield or Covaxin. Either of the vaccines you can take it very safely and there are no contraindications for it.
Doctor, the second question is, if someone is on blood thinner, can he or she take the vaccination?
Yeah. So if anyone is on blood thinner, there is nothing to worry as such because the vaccine is given on the upper side of the deltoid and it is given with a very small needle. So the chances of developing any blood clot or hematoma is very, very less. In any ways, you should always, the patient who is on blood thinners will always be monitoring their INR. So when they are monitoring their INR, the INR should be in the range of around 2. Yeah, unless and until the INR is very high, it's in the range of 4 or 5, there should not be any contraindication to take the vaccine. So in general, even if you are on anticoagulants, not to worry, you can take the vaccines very safely.
Doctor, the next question is it possible if someone takes vaccination and may have adverse effects?
So the vaccines, the Covishield and the Covaxin, both vaccines are very safe, and whatever data we have regarding the trials, there are very few adverse effects which have been reported, almost none at all. So both the vaccines are very safe, the chances of adverse events are very less, and there is a made up provision that after taking vaccine you have to sit for 30 minutes. So if at all you are developing any adverse effects, we will pick it up within the next 30 minutes and that can be treated accordingly. But in general, there are very few side effects with both of these vaccines.
Doctor, next question is, under what medical condition should one not take vaccination?
So we do not have data whether the pregnant females and the women who are breastfeeding whether they can take the vaccines or not. I think both it is safe to take vaccine in either of these conditions, but we do not have enough data on that. And because we do not have enough data for these pregnant patients and breastfeeding patients, that is the reason why I would suggest that avoid taking vaccines if you are pregnant or if you are breastfeeding. Maybe over a period of time we will have more data on that and maybe then we can allow the vaccines to be taken during that period of time. But as of now, these two conditions, there is no data available, and you don't take vaccines if you are pregnant or breastfeeding.
Doctor, should one consider about the brand of vaccine? Like we have many different variants or we have different brands of vaccine. Should it be of a concern to take a particular type of vaccine?
Yeah, see, Covishield is basically a vector vaccine. That is, they make use of an adenovirus and they transfer the genetic material of the spike protein into the body. Whereas Covaxin is an inactivated vaccine which makes use of an inactivated SARS-CoV-2 virus. So both are of different platforms. One is a vector vaccine, one is an inactivated vaccine. But the point is that both the vaccines are safe, both the vaccines are efficacious. So there is no particular reason that I should choose one particular brand only. There is enough data available about the efficacy of both the vaccines and both the vaccines are good enough. Take either one of the two. There is no need to be particular any one particular vaccine.
Doctor, what is the ideal gap between two shots of vaccine?
Yeah. So initially the gap that was suggested for Covishield was around 4 weeks. But we have more and more data which suggests that as we increase the gap period from 4 to 8 weeks, the efficacy is better. So the current recommendation is if you are taking a Covishield vaccine, the recommendation is to keep a gap of minimum of 6 to 8 weeks between the two doses. Whereas when I talk about Covaxin data has suggested that two doses between an interval of 4 weeks is as good as between 8 weeks. So for Covishield, keep a gap of 6 to 8 weeks between the two doses. For Covaxin, you can keep a gap of 4 weeks between the two doses.
Doctor, can someone take vaccination dose from two different hospitals or like two different locations?
Yeah, there is no problem in taking vaccines from two different locations so long as you're taking the same vaccine. So if you have taken a first shot of Covishield, make sure that your second dose is also of Covishield and vice versa for Covaxin as well. So take it from two different locations, that is not an issue, but make sure you take the same type of vaccine in either cases.
Doctor, once a person takes the vaccination, like both the shots, is there like 100% surety whether he or she will be free of like fear of COVID-19?
Yeah, so as I told you, let us look at the efficacy data. So when you talk about Covishield has an efficacy data anywhere between 70 to 80%, and Covaxin has an efficacy data of anywhere between 80%. So when we talk about efficacy, that is the amount of percentage of protection you expect to get from a vaccine. So in either of the two vaccines, the efficacy is not 100%. So what does that tell us? That tells us that basically you are not 100% sure that you are not going to get any disease from by taking the vaccine. So once you take a vaccine, don't loosen your guard. Make sure that you wear the mask, you use hand hygiene, you maintain social distancing, because vaccines are not 100% efficacious. That needs to be mentioned. On the other hand, you have to understand the vaccine. Once you take the vaccine and suppose you get the COVID infection, the intensity of the infection will be much milder. So that is how it protects. So it may not protect you from the disease altogether, but if you get the disease, the intensity of the infection will be a mild COVID and you won't go into severe COVID. So in both ways, you see the vaccine is protecting you against the disease and against the severity of the disease as well.
Thank you, Doctor, for answering all questions received from members of Shagun Cooperative Housing Society, Seawoods.
Sure. Thank you very much.